Welcome to the Transformative Neurotherapy Podcast with your host, Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. This is the place where healing happens faster. Because let's face it, your brain doesn't come with an owner's manual until now. Here, we take a holistic approach to brain health, bringing together science, mind-body harmony, and the tools you need to optimize your well-being. Whether you're a high performer, executive, athlete, longevity hacker, or just someone tired of your brain working against you, Dr. Putney is here to help you unlock your full potential. From brain fog to chronic stress, we're covering it all so you can finally experience brain health, mind harmony, and total well-being. Ready to get unstuck? Let's get started.
ADHD isn't just about distraction, it's about regulation. Dr. Putney shares how neurotherapy helps clients build focus, calmness, and confidence without relying solely on medication. Welcome, everyone. I'm Julie Schwenzer, co-host and producer in the studio with Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. Dr. Heather, let's just dive in. How does neurotherapy help with ADHD?
Neurotherapy part of me feels like neurotherapy is designed for ADHD, but that also might be because it's one of the reasons why I sought out the training. Myself, I have ADHD and it's highly genetically linked. So I've got two neurospicy children as well. And I was looking for, in addition to helping some of my other clients get unstuck, I was also looking for some non-medication approaches to help balancing the brain. So for myself, I was able to kind of manage and learn some supportive skills growing up, and I wasn't medicated. But then I have two neurodiverse boys and they look different, so every ADHD person, they say if you've met one person with ADHD, you've met one person with ADHD. The flavors are a little different. The manifestations are a little bit different. So then when my kids hit school age, it was kind of like off the charts, and how could we support them, because they didn't manage things, and the same executive functioning supports that worked for me did not work for them. And so we had to kind of start thinking outside the box. And so that kind of drew me in to exploring neurotherapy as an option. And what's beautiful about it is it works wonderfully to help balance brains with ADHD.
And what are some of the core brain patterns that you do see in your patients with ADHD?
Yeah, that's one of the kickers with ADHD. And I've talked about how one of the big things we do with neurotherapy is we start out with that assessment. And so when you are, when you get a kid in or an adult in with ADHD symptoms, they can present very differently. So the symptoms can look fairly similarly. Sometimes they tend to be more ADHD-I, which is the inattentive, so they're jumping in, this, that, and the other. Or you have the hyperactive, the kids that can't stand in their seat, maybe a little bit more emotionally reactive. Or sometimes you have the combined pattern. That's what you're going to see in the DSM-5, the kind of diversity there. But when it gets to brain patterns, it's a completely different scenario. So there's kind of 8 main profiles of ADHD brains. And then there's about 4 of them that create ADHD symptomology, but it's actually got a completely different, more kind of medical cause. So it can create some of those symptoms, but it's actually something else and it needs to be intervened in differently. So one of the most beautiful things about being able to understand ADHD and treat ADHD is that we can get specific, because the symptoms can look very similar, but the etiology, which is the underlying cause, is different. So for example, one common profile with ADHD, and it also has an overlap with addiction and it has an overlap with anxiety, is a low voltage, which is a lower power with a lot of fast, some of the extra beta, a little over aroused profile. And so those adults and kiddos can be they're feeling a little bit anxious, a little bit more agitated, don't have enough calm and chill. And that's actually a more genetic profile, because their brain tends to produce a little bit more GABA A receptors, which pulls out the calm and chill neuro GABA in our brains. And so they're feeling a little bit more edgy, so they just can be a little bit more reactive. And when you're feeling like that, you might tend to be drawn to things that will help self-medicate. So, if you get older, you might reach for alcohol, which will calm and, will calm the brain down. And so you end up like being drawn to certain things that kind of help you to take the edge off. Right. So that's one of the reasons why it can be an addictive profile, because, people are drawn to things that they just notice, oh, this works for me. I feel a little bit more calm because my baseline is just a little bit hyper aroused. Right. So that's one common profile. Another profile, and by the way, that profile, if you put that ADHD, highly distractible kid on a stimulant, it's going to rev their brain up more. That could create more anxiety. It rarely turns out well. So then you see ADHD and you think, oh, stimulant. This group doesn't do so well on the stimulants. Okay. So let's switch to another very common profile with ADHD. And it has some sort of slow wave pattern going on, usually in the frontal regions or the midline. So like more of a theta pattern. And so the brain just is it's a little groggy, it's a little slow, and that part of the brain, those certain parts of the brains need a little speeding up. Those kids do respond pretty well to stimulants, but we can also treat that with neurotherapy to help just kind of like boost this area, get it running a little faster, a little bit more seamlessly. And so we can kind of, treat that way as well. But sometimes what people are looking for is with the scans is like, well, if we were to medicate, because things are off the chart, they're failing out of school or this, that, and the other. If you were to do that, which medication would work better? And this can kind of guide which medication choice you may use if you're going to do that, or if you need to do that in the beginning while you start neurotherapy, and then they start to get more balanced, and you want to wean off. That can work as well too, as long as we're working closely with the providers or the prescribers, the psychiatrists or the PCPs. So we don't do any medication prescribing, but you can come in and be on ADHD medications or a combination of things, and that doesn't change whether or not you can get help from neurotherapy, because it's very targeted. Another profile that we see a lot with ADHD is maybe these kids have come in and they've tried stimulants, they've tried a variety of things, and they failed a lot of different medications, and they're still really suffering. Sometimes what we see is they've got complex brain patterns. They've got part of their brain that's revved up a little too fast and part of their brain that's working a little slower. So what generally happens with medications is they tend to do one of two things. They tend to speed up the brain or calm the brain. And when you're putting it in, and when you're taking medication, it kind of puts it in your, and that's oversimplified, but for the general population, I think that's a good enough explanation. But when you're taking a medication, it's systemic. It's going to impact all the brain globally. So when you've got these people, these mixed characteristics, like their frontal lobe is running a little faster, they're highly distractible, this, that, and the other, but some of the, they've also got some slower processing stuff down the middle and the midline. They tend to fail medications, and they're still suffering. So what's beautiful about neurotherapy is we can actually soothe that kind of that faster wave, like give it some calm and chill, and then work down the midline or whatever area that the EEG indicates, so the brain maps indicate, needs a little bit of, speeding up and, strength training really for those spots. So it works really, really great it works great for everybody, but for those clients that have just failed meds, it works exceptionally well because we can give them exactly what they need, exactly where they need it. And the medications just can't target it like that. So.
And I appreciate what you said too, that all the ADHD, patients, everybody's different, and we're not, whoever has it is not just a number to you. And I really appreciate that too, that everybody's treated like an individual. And with that, how do you tailor the session to the different patients that walk in? You have kids and adults coming in and with different severity levels or whatever it may be. How do you tailor the session when somebody walks in like the first time and they're like, I've been diagnosed, help me?
I tailor the sessions by starting with the scan and the report. So I know the exact treatment, the exact frequencies, the exact placement before I even go to touch their head. And it's not so different between the adults and the kids. The intensity at which we give when we're working with the electrical stimulation, there's a certain level of intensity, or the frequencies, not the frequency, but the power of intensity we use. It may not be, we might not go up as high for a kid as we would an adult. Teens can usually take it if they want, if they want to get a little bit higher dosage. But for the most part, we use the same modalities. We can use the LED light therapy. We can use the PEMF, the magnetic force things, and we can use the electrical currents on little kids through adults. So the treatment doesn't change a ton. If kids are super sensitive, we can just, use one modality instead of all three. But we usually generally do quite well with layering, but it might just be like, how strong do we turn it up for the kids? We also may allow the kids to play on an iPad or distract themselves a little bit with something while they're getting the treatment so they can, tolerate it a little bit more or sit in the seat a little bit better, because we're talking about wiggle butts, right? Up and down and all around. You don't want them pulling off their stuff. So, we may allow them to do that, whereas we might encourage the adults to do something. If you're ADHD and, struggling with something, we may ask them to kind of focus on something that they're struggling with, or do brain training exercises on their phone, which will help strengthen some of the executive functioning. So while we're juicing it up, we're actually having them do some exercises as well while they're getting the treatment. So we're reinforcing that. So it's kind of a win-win.
Oh, that's wonderful. And a last question for you: what kind of improvements do many of your patients report that they're noticing? Like, is it focus? Is it better emotional regulation? Is it a mix?
Yes. So it depends on the kids. One of the things you also see a lot with our ADHD kids is there's a lot of overlap with potentially like learning disabilities or things like that. So we see a lot of overlap with dyslexia, dysgraphia, things like that, reading challenges or whatnot. That tends to be a little bit further back in the brain. But we see kids who came in really struggling with reading, and they're doing neurotherapy. They're getting better support up here. Maybe we're doing a little bit of work back here, and their reading scores improve. Their ability to understand things, so their ability to process it flows through the brain better. So we frequently see academic improvements. We see the ability to focus increase as well, and definitely behaviorally. So especially when we've got those kids like those beta spindles in the frontal, those tends to be the more reactive, more emotionally volatile children, and they definitely calm down. They can get a little bit more breaks. There's a little bit more ability between the action and the reaction. They might be able to think about and apply some of the things they might be learning in, if they're working with school counselors, like social skills settings. One of the biggest problems with ADHD brains is it's like you've got a Ferrari engine with bicycle brakes. So they have a lot of go and not a lot of no. And so that impulsivity, that reactivity is just really, really high. And so one of the things that our therapy can do is it kind of helps give them more breaks, so they can kind of pause and make an intentional decision versus a reaction. So it goes really well. And I hate to do anything even with neurotherapy and say like talk therapy is not important, because that's not true. They blend together perfectly. But if you teach a kid with ADHD or even an adult all these skills, right, about what to do, on how to manage this, that, and the other, but their brain goes from 0 to 110 so fast, they don't have a chance to apply the skills. It doesn't work. But with the neurotherapy, if it gives them a little bit more pause, a little bit more time, then they can utilize those skills and they start to become more successful. Those things that you're teaching them, they're there, but they can't reach for it fast enough to utilize it when they need it. But with that beautiful mix of that coaching, or the psychotherapy support plus the neurotherapy, it just gives them more choices, and they are less emotional, less reactive, less, meltdowns, less overwhelm. It works better not only for them. I mean, and I work with a lot of adult ADHD clients as well. Their ability to start and finish tasks that they don't like, non-preferred tasks, increases. The dishes are they're just horrible. I can't get them done, or the laundry, or this, that, and the other. And they're like, I'm noticing that the dishes are getting done more consistently, this, that, and the other. And it's not so painful, So those are some of the beautiful things. They find themselves being more efficient at work and things like that.
Dr. Heather, you mentioned that there are some clients that come in and they think they have symptoms of ADHD, or they have ADHD, but they actually don't. Can you tell us more about that?
Yes, there's about 4 what we call imposter, or what we can kind of refer to as imposter profiles that symptomatically, they might actually come in with a diagnosis of ADHD. But when we get down to the brain profiles, that's not what's really going on. So, for example, one of them is they might have paroxysms in the brain, which basically means, and it's a big word, but it basically means the brain has a lot of electrical misfirings, things like that. It's kind of an unstable brain. And when those happen, it can create panic. It can also be like a brain wipe. It's just like I was talking and now it's gone, So when we see those patterns in the EEG, that may be a refer out to a neurologist to take a look at, because it's not true ADHD. And you add certain medications to that, you're going to make that worse. But it can have an ADHD symptomatic flavor. But, from the client, they think that's what it is because I was doing this and now it's just like I lost everything, or I just feel really overwhelmed. But that's not really what the core source is. And so we see those, and then we start collaborating with other providers. That's also true for absence seizures. So it has a very similar kind of profile, electrical misfirings. They kind of get a blank stare. They forgot what they were doing or whatnot. So if we see some really bizarre firings in there, that's when it's going to be, I'm not going to diagnose that. I'm not a neurologist, but I can, see that there's something going on here. That's an immediate refer out to a neurologist, because the treatment's going to be different. It's not like neurotherapy is what's going to fix that. And another big profile that we see is a vigilance regulation issue. It's basically a sleep issue. And so there's a lot of overlap with sleep issues and ADHD. And there's a lot of talk even in the research that, kind of what comes first, the chicken or the egg here. Do they have ADHD symptoms because they can't sleep, they can't stay awake? Or does the ADHD, those vigilant issues cause this? But sometimes there's really a true sleep issue. And so they look like they can't focus at school or this, that, and the other, but they may have an apnea. They may have restless legs. They may have a medical reason why they're having such sleep issues. And we can see some of those profiles also in the EEG. So we actually might refer them out to their doctors or whatnot to potentially order a sleep study. And there might be a medical reason why they're presenting the way they are. So in addition to seeing the profiles where we can do a lot of work with neurotherapy, or even work with their PCPs or their psychiatrists to like fine tune, if you want to use a medication, which one might work better with their brain profile. There's this other cluster of, people that look ADHD, but that's not really what it is. But then we can get them maybe to providers that they wouldn't have otherwise have gotten to without that insight. So that's one of the things I love about the work I do.
Yeah, that's amazing. Just the revelations that come about by you. It's like how much stuff you're discovering as you go through this process. Well, Dr. Heather, thank you again for shedding light on this powerful approach to healing. We really appreciate you. And we'll see you next time on the Transformative Neurotherapy Podcast.
Thank
you. You've been listening to the Transformative Neurotherapy Podcast with Dr. Heather Putney. Remember, your brain isn't supposed to hold you back. It's supposed to power you forward. So stop letting it crash your party and start letting it do its job. If you're ready to optimize brain health, sharpen your focus, and age like a fine wine, schedule your free consultation today at transformativeneurotherapy.org or call us at 412-204-7397. Because here, healing happens faster. See you next time.